Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we're with Antonio from European Medics. Antonio, welcome to the program.
Thank you so much, Aebhric. It's a pleasure to be here.
So tell us a bit about yourself and what's keeping you busy.
Well, I'm the founder of European Medics, so that's currently what keeps me up at night. I'm also in medical school right now, working on my MD, and I have a background in emergency medicine. So, yeah, that's a couple words about me. And for EURMED, we're working on a couple of projects right now.
So you keep popping up on my radar because of your work with Guerrilla Medicine. But before we jump into that, what is European Medics?
European Medics started out as a community of people on social media that just are very passionate about emergency medicine and like to torture themselves with the most difficult version of it, which I think is austere and remote medicine due to its resource-limited nature. And our goal was originally just to bring together people and enhance the exchange of information between medics and generally healthcare providers throughout the medical field globally, not just in Europe, as the name might suggest. And then it grew, and we started focusing more on educative aspects and on enhancing medicine itself and developing new aspects of it, and playing a more active role in procedures and how things are done in the field.
So it's obvious that austere medicine is your fire in the belly. Where did this passion come from?
I started in civilian emergency medicine, as many of us have, and I quickly discovered that the austere environment just has a thrill to it due to its unconventional nature and its unique challenges, the planning that needs to be done surrounding that, and the implications, the whole spectrum of capabilities that a provider has to bring to the table, not only in the medical field, but also in terms of, field craft, navigation, rope work. There's so much more. So that got me really excited, and I decided to pursue that path further.
So you have a group of people on European Medics. Can you tell us a bit about that? Are they all similar to yourself?
Sure. The EURMED team is very diverse. We are very blessed and lucky to have people from all walks of life, military, civilian, law enforcement, search and rescue, all levels of care, from EMT to board-certified surgeons and other professionals. Also non-medics. We have quite a bit of non-medical people also that are taking care of other aspects of care that are not necessarily purely medical. The group is very diverse. We're very lucky to have them.
I appreciate the challenges it would be to get a bunch of people into a group. It's like herding cats. So trying to get all these motivated people into one room. How did you manage that?
It really kind of formed itself. At the beginning, we were just talking about the passions and our interest in medicine, and then more and more people got together. We started a Discord server where interaction started to happen. So it was not just the community listening to what I, talk about on Instagram, but just discussion between individual members. And we decided to get a podcast going, and people started listening, and there was feedback, and now the community just grew and grew. And it's just an incredible journey, and I feel very blessed to be part of that.
So you do have a podcast. Tell us a bit about that, and what is your goal with that, or what are you trying to push as far as information or training?
Right. So our podcast has multiple shows, if you want that, to use that word. Basically, one of them is medical basics. So we talk about, it's more oriented towards beginners. So people that have either an entry level or no level of education in medicine and emergency medicine. And we talk about, fundamentals of emergency medicine that can occur and how to take care of that on, a more basic level or more of an entry level, I should say. Then we have the field clinic, where we discuss guerrilla medicine and more of the green side of stuff, more of the military related things. And then we have our long format, which is discussions with subject matter experts that we invite, and we just talk about topics and discuss in an open manner. And these podcasts can sometimes take up to 2-3 hours. So yeah, we just let it flow.
I do like the mix, and I do look forward to seeing those when they pop up.
I appreciate that a lot. Thank you. Yeah. Well, likewise with the Quorum podcast, always very interesting.
So you have a lot of irons in the fire when it comes to European medics. Which project is your main focus?
At the moment, we're actually preparing more to go into education. So we are focusing on creating training material and educative resources so we can go out, teach courses more effectively, and really get training to the people where it's needed. So that is our current main focus. That includes all the background work, so creating curriculums, acquiring resources, developing guidelines, etc. So yeah, that's what we're working on right now.
So you've created an Advanced Guerrilla First Responder. Is this what you're on about?
Yes, that is one of them. So the Advanced Guerrilla First Responder course, or the AGFR, is what we are working towards. We have various subcomponents of that. So one of them is a basic prolonged care course, which is basically PCC, but like more at the EMT or combat medic level. So just to provide people with an introduction to prolonged care, strategies of nursing, taking care of patients in these resource limited environments for longer than just a few hours. So that is one of the middle steps between right now and the goal, which is the AGFR course. Yes.
Did you base this off of the Wilderness First Responder concept?
Primarily based on the Ranger First Responders courses. So they have some really interesting approach to medical care in the Ranger Regiment, and we were inspired by that, and tried to merge the more slow, methodical nursing approach with the trauma medicine and the course structure that is provided by the Advanced Ranger First Responder courses.
Do you have Rangers on your faculty?
We do have Rangers and people that teach the Ranger First Responder courses in our team, yes. We're very lucky to have them, actually.
So you are looking at two levels, the RFR and the Advanced RFR, or the GFR and the Advanced GFR. Can you tell us a bit more about the curriculum? Let's start with the basic. So your GFR course, what is that?
Right. So the basic, what we call the prolonged care course, the basic prolonged care course, BPC. That's more of the nursing side, because we assume that people that would come to us would already have some fundamental knowledge of first aid, or some approach to patient care already developed. So what we want to do is fill in the gap, provide the austere and the emergency nursing side. That is not often talked about, by emergency medical courses, at least here in Western and Central Germany. Western and Central Europe. So that's what we are focusing on. And then the AGFR course is really just the full deal, where we go from the beginning, but we also dive a bit deeper. We go into advanced diagnostics, interpreting capability that is available in the austere environment sometimes. Such as, ECGs, blood gases, urinalysis, this kind of stuff.
So you're expecting the AGFR to have people who are already clinically certified?
Correct. Yes. I mean, that's optimal, but if a person comes to us with no knowledge, I think with the pre-work that is supposed to happen before the course, I'm sure a person could get themselves to a certain degree of proficiency. So optimally you would have some background in emergency medicine already.
So are you expecting them to do online work before they come and then do the hands-on?
Right. So the course is designed to work in a hybrid mode. So we would have educational material done beforehand, and then there would be some online tests, and then the participant would come to us and we would practice the skills that were taught online and put into perspective and manifest it in a real environment on patient uh, on patient simulators. So yeah.
How long is the basic course and how long is the advanced course?
The basic is about 2 to 3 days, depending on the available time. And then the advanced course is like 4 to 5 days of practical and about a month of self-paced learning.
So it's similar to like a 9-day or 10-day RFR or advanced RFR.
Yes.
And are these mainly Europeans coming through your program?
Well, it's really anybody that wants to participate is more than welcome. So we don't discriminate, basically.
Can you say where you're running these scenarios?
Well, some of the courses, the basic ones, were held by me at the university that I go to. And we have yet to run the big AGFR course because we're in the process of developing these materials for self-paced learning, etc. The guidelines, the handbooks, and it just takes a lot of time because all of us are active medical professionals, and we have other duties that we need to attend to. So, but we're making good time, I think.
I appreciate what you're going through. This is something that has been the bane of my existence for over a decade of trying to backfill a good idea. Like I got together with some friends and said, "Hey, let's make a master's in austere critical care," and sure enough, we did. But it's we've been running it 3 years, and we're still working on it, still making it better and better. So I do understand that you're getting your online content and getting your curriculum and getting all of the scenarios sorted is a challenge.
Yeah, I think Quorum as an entity is just playing on a completely different level than us at the moment. Obviously, designing a master's is like unfathomable to me. I don't think EURMED is anywhere near that. But yeah, we're trying our best to do what we can at our level, and maybe one day we'll be able to play anywhere close to the college's league. So yeah.
Well, in all fairness, mate, I started out with remote medicine Ireland about 15, 20 years ago in Ireland, doing precisely this. I know not guerrilla medicine. Now you're definitely cutting edge on that. I was focusing on wilderness first responder, wilderness EMT, and even getting those up and running with, I had 4 faculty at the time, another Green Beret that was in Ireland, and he was a PA, and a few others, and just the arduous task of starting from zero is definitely a challenge, and I appreciate what you're going through, even at the GFR and the advanced GFR level.
Well, thank you. I really respect that. Thank you.
So that means you're looking at a guerrilla EMT. Is that a GEMT? Are you on about that as well?
Well, eventually, if we can talk about it, sure. I would like to make the courses somehow compatible with current curricula, and it's not an easy task because obviously every country in Europe at least has different standards. Like even the EMT in one state can be completely differently qualified and trained than an EMT in the neighboring countries. So it's a bit of a difficult task. If we can get to that level, obviously that would be amazing. But yeah, we'll try to take it one step at a time, and eventually time will tell what our capabilities can be.
So let's talk about guerrilla medicine. Let's take a deep dive into that.
Sure.
And there's a lot of books on guerrilla medicine that I've been reading that's been pop up from the MSIW guys. I don't know if you've come across them, the medical support for regular warfare, and seeing how guerrilla medicine was conducted in World War II and all the way back to like Francis Marion with the Revolutionary War in the States. But it's interesting so I'm in Germany as well. I married a German. I've been here 15 years now. That there's a history of this in the Forest Brothers and Lithuania and Latvia and Estonia. And are you looking at this as an outcome, or how much of a historical background have you looked at when you created your GFR program?
It definitely plays a huge role. So history obviously shows us so much and can teach us so much. Actually, I'm partially Polish, and some of my ancestors were participating in guerrilla medicine in Poland during the Second World War. And the systems and the structure of resistance, and being part of a resistance movement has always really intrigued me. since childhood, since hearing, the stories from my grandparents and great grandparents actually at that time. So yeah, history plays a huge role. It's very important to look at the whole range of different environments as well, because guerrilla medicine obviously was practiced not only in Europe. There's a lot of historical accounts from Asia, Central Asia, Southeast Asia. There's accounts from South America. So it's really a very broad spectrum. There's even like historical accounts from the Civil War in the United States. So every conflict has its own kind of operating and like working, and every conflict can teach us a new aspect of the whole picture, which is guerrilla medicine and like medical support in irregular warfare, or some kind of asymmetric conflict. So each history from like each nation can teach us a lot of stuff. So it's really worth it investing time and going through the records, even if it's sometimes a bit strenuous to read a lot of material, written in old language, or in foreign language, and having to translate. But it really is worth it.
That is a challenge. There's so much out there that isn't in English.
Right.
And I've focused a lot of my readings on the Forest Brothers and Lithuania and Latvia, and as well as the Balkans, because of the Guerrilla Surgeon books and the Parachute Ward and Black Scalpel, the three that MSIW suggest. Yeah. And we're missing so much because there's probably tons in Lithuanian language. But can you speak on what I haven't looked at Poland? So what is the history of guerrilla medicine in Poland?
Well, Poland, as it is, was running one of the biggest resistance movements known to mankind during a full-blown occupation, obviously during the Second World War. And they had a huge system with courts of law that were underground, with a government in exile, with underground police, et cetera, et cetera. So it was a big entity that also had like underground schools and universities, and it's very intriguing, honestly. If somebody, if like people like to read about history, I would really recommend looking at the Polish resistance movement in World War II. There is also a really amazing museum in Gdańsk in Poland, which I can definitely recommend going to and have a look.
Nice.
Yeah, medicine was always a huge part of that. Obviously, medical support in irregular warfare plays a huge role, not only in terms of actual like providing medical care, but also in terms of morale. It's a very important factor for the troops, knowing that there is somebody that can take care of them if they get injured, or when. So yeah, that's a big thing. And Poland was running a very elaborate system of underground hospitals and evac routes, etc., to smuggle injured personnel through a German occupation. So yeah, there is a lot of historical material that we can tap into and look at.
Do you think that there's a possibility of similar situations happening in the near future?
Well, thank God, not in this context anymore. I think in outside conflicts with other parties involved, I think that sadly might be a reality. I really hope that's not the case, but yeah, even if we don't implement these lessons learned here in Europe, I think they're more than valid for the next conflicts, even in an expeditionary manner, wherever that might be. So I definitely think it's worth looking at these lessons and still learning them, making preparations, because we can apply this knowledge and export it basically anywhere where our next area of operations might be.
You had some work in Ukraine. Speaking of unconventional warfare, shall we talk about the elephant in the room? Would you be willing to speak on that? Have you been doing GFR courses there, or what is your push for Ukraine?
Right. So personally, I haven't been over myself. We have some of our senior team members that were doing medical care in Ukraine for multiple weeks, sometimes months. We do have the curriculum of the rudimentary Gen 1 curriculum of the basic GFR course. It was done not by us, but friends of us that are working in Ukraine right now. So it has been done. And yeah, we've had a lot of interaction with Ukrainian medics very early on, because we started our telemedicine project. So that was one of the the things that EURMED was very involved in. So basically, when the invasion started, I just really wanted to help as soon as possible. And a lot of people were sending over packages with goods and stuff, but like I was really like very intentionally focused on providing what we can do best, and that is just being medics and doing medicine. So we started an online telemedicine service on the Discord platform because it's easily available, it's free, and we asked willing providers to join us and to create a 24/7 interdisciplinary telemedicine hotline where people could just tap into it and get the help they need from certified professionals. And yeah, that's what we did.
Wait, you had a telemedicine project based on Discord.
That's correct. Yes.
How did that work?
Yeah, it was very functional. We had multiple calls, some with civilians, multiple with members of the Ukrainian armed forces or of NGOs. And yeah, so people would come in into like a designated channel, whether that was text or voice, both were available. We decided to offer both services like through text and voice because sometimes the network coverage doesn't allow for voice comms, so text is the only answer, and text is the only option, and that is quite difficult sometimes as well. So a person would join the server, get into like the designated channel for that, and then we would have providers monitoring that, and they would jump in and then take it from there. We had a call script. We would request the relevant information and then provide evidence-based guidance based on that.
So tell me you've published that concept.
Well, I mean, sorry, what do you mean by published?
What, like, that is a fantastic article, mate. Tell me you've written something and submitted for publication.
It's in the works. It is in the works. Yes.
Fantastic. Who are you planning to go through?
We haven't really decided on that yet. There's a couple of people involved, so we'll see where we'll take it. But there is definitely an intention to publish papers on that for sure.
I would suggest you think about JSOM.
Well, definitely. That would be amazing. Yeah.
So you had an article called Lessons Learned in Ukraine. Can you discuss that?
Sure. So yeah, during the Ukraine invasion, actually right before that, because before the second invasion, so 2022, we wrote a paper that was talking about guerrilla medicine. And well, a couple of days later, Ukraine got invaded, so it was really perfect timing. And yeah, we discussed the concepts that are involved in providing guerrilla medicine and what that even means, how guerrilla medicine integrates into the whole concept of like civilian healthcare and military healthcare and where the areas overlap. And yeah, it came in very handy. It was distributed pretty widely in Ukraine from what we know through friends. We were very thankful for the people that shared our material. And yeah, it's publicly available for download on our website as well. So if anyone is interested, go for it, have a look. And yeah, we did look at Ukraine pretty intensely and tried to extract the knowledge and distill the lessons learned through many areas of front lines, through different types of providers and different aspects of care. So it's not just the medics during the first contact. We're also looking at forward resuscitative points, what they call like stabilization points, basically, field clinics, and then you all the way back to surgery and in big hospitals. So it really is a big chunk of data that we're trying to process and talk to people, gather the experiences. Obviously, it's still an ongoing conflict, so it's a bit difficult to get your foot in the door in all the right places. But yeah, it's very important that we look at these experiences and learn from them, because the knowledge that we gain from them is very relevant and is very important for the future for us to understand and develop new procedures and new guidelines and expand our knowledge of how conflicts work, really, and how that might interact with medical practitioners and how we provide care.
There is a profound amount of data points that are happening and cases that are happening, and we're not catching them. We're losing all of this cutting edge knowledge
Yes.
and learning and training that's happening on the Eastern Front.
Yeah, it's very unfortunate. The Ukrainians are hard at work establishing a joint trauma system, like a trauma registry, where all the data will be gathered in a central location about casualties and wound profiles and timelines, et cetera, and treatment provided and efficiencies and outcomes. But that obviously takes a lot of time. The Americans are very actively helping in that, so that's really great. They have a lot of experience with that, so. I have high hopes for the future, but as you said, yeah, the initial data, it's very difficult to recover that. So
let's look into the future. Let's see
right.
that you have finished medical school. You've definitely hit the ground running, as you already have. European Medics has matured and it's stood up on its feet. Tell us, what does that look like to you?
Well, I would love for European Medics to continue being a melting pot of experiences and just a neutral ground for the community to meet in and to exchange experiences, to have conferences where we can talk about medicine and all its different aspects. I would also love to go deeper into education at that point. I would love to be well in the habit of giving courses and providing expert medical education to people through subject matter experts and just bettering the community, expanding the knowledge that we have, tap into the new and unexplored, and that is what I think EURMED would be best in.
Are you seeing this as kind of like a Royal College of Medicine in the UK, where they just have a clearinghouse of data, or are you looking at this as more of an educational output, or what is going to be the European Medics?
I think education will definitely be a large part of that, definitely. I think most of us being active in healthcare in their respective niches also are bringing a lot of experience in through their daily interaction with patients and the medicine on a daily basis. But yeah, I think the primary role of European Medics will probably become an educational entity.
And you've named it that because it doesn't necessarily mean doctors, it doesn't mean paramedics, or are you looking at this as a group or whoever happens to be working pre-hospital? What do you mean when you say European Medic?
Right. So European Medics was really like the name doesn't really exclude anyone. We like half of our followers and our community members are American actually. And yeah, we're very happy with that. We have great relations with the US and we are definitely an international entity, and it doesn't even have to be pre-hospital. I think that medicine is really such a broad spectrum of applications and things that you need to know. So somebody that is at EURMED could also be an expert climber that is really good at teaching rope access, and stuff like that, or an expert driver that can teach a professional medic to drive off road or be safe when navigating the terrain. So European Medics really is a cover or like an umbrella term for anyone that works in bettering patients' lives, and the origin really plays no role, I would say, in EURMED actually.
So you see a global reach.
Right. I mean, optimally, I would love to have members from all around the world. Yeah.
And you're looking at having it based here in Europe, or are you where is the base of European Medics?
Right. So we have a couple of locations that we switch between. Primarily, our location is Germany. So we're working out of Cologne, Germany most of the time. Also, since I'm studying abroad, that location is also very frequently used. And we're also frequently in Austria because a lot of our team members are from Austria. So we spend a lot of time in the mountains.
But you plan to do things in the States as well?
We're very lucky to talk to a couple of people that already provide amazing courses, and we're looking forward to strengthening these partnerships and tightening bonds and hopefully bring some of the EURMED philosophy to the States and interact with other people as well. Yeah.
So what do you see the college can do for you?
Well, I think the college, as it is doing a tremendous job at educating. I've had the pleasure of speaking to many people and current medical providers that came through the college in various programs, whether that is the remote EMT or the bachelor's program that you guys offer that really just pumps out amazing providers with great capabilities and very high motivational levels, which I think is very important as well. So I think as it is, the college is already doing a phenomenal job. But I think what we can offer the college and and enrich medicine in that way is just our approach of like unconventional medicine and the contacts and experiences that we can bring to the table from conflicts like Ukraine and other irregular activities basically. So yeah, I think there's a lot of overlap between EURMED and the College of Austere and Remote Medicine. Certainly, when it comes to like the science of medicine and what we want the provider to be able to do in the end. So
Maybe we need to look at a master's in guerrilla medicine.
that would be incredible.
As long as you do all the writing, because that's
All right.
the amount of work. Fair enough.
Oh yeah, once I'm through med school, that's definitely something I would love to work on. So absolutely.
So I asked you about the future of EURMED, and I also want to ask you, keep your goggles on of your future goggles, and where do you see guerrilla medicine?
Well, I think we are at this very particular point where we realize that guerrilla medicine is something that needs to be taken very seriously. I think a lot of people at the moment were looking at guerrilla medicine as being kind of, a niche topic, something that is fancy or that is, fantasy land. And I think the bitter realization has hit us that we need to take it very seriously when we look at Ukraine and how that affects the civilian population. It's not just something that is military only. It's very much something that involves a civilian medic as well. So when I look at the future of guerrilla medicine, I think guerrilla medicine will become an integrated part of how we teach forward medicine in general. Like it will become part of the general knowledge. It will become part of the SOPs, the way how we run casualty collection points, the way how we organize casualty evacuation and patient flow and forward clinics and how we staff them and all of that. I think that would become much more of a public discourse, which I think is obviously great for the science and very important. So that's where I see guerrilla medicine much more in the public eye than what it is now.
So you see it as a subspecialty within emergency medicine?
I think it's well, in the end, what we do is we take care of the human, right? We take an injured human and we take care of them. So the fundamental essence of guerrilla medicine and, for example, wilderness medicine or remote medicine or just civilian emergency medicine really is the same. The patient care doesn't really change. I think that's a common misconception as well with people listening to our stuff. They think that the medicine somehow changes, and that's not the case. The guerrilla medicine still is the same evidence-based emergency medical practice that we learn in universities and hospitals, etc., or paramedicine schools. But really, there is another flavor to guerrilla medicine, which consists of a lot of unconventional planning, lack of resources, and also the ability to mobilize people, because obviously in a conflict, when we're talking about a situation where an irregular conflict is being waged in a country, the civilian population is usually affected, and it's important to be able to mobilize these skilled people, for example, local medics, local nurses, local doctors that have no contact with tactical medicine whatsoever, and to include them in this care continuum that is created in this area, following a crisis. So I guess it is kind of a subspecialty. It's probably a subspecialty of emergency medicine or wilderness medicine or tactical medicine for that matter. It's all really a melting pot, and the borders between these are very loosely written. So yeah, I think that it just is a very mobile field that taps into a lot of specialties and needs to be proficient in a lot of spectros to work well.
What differences do you see between guerrilla medicine and MSIW, the medical support for irregular warfare?
I think fundamentally they're following the exact same principles. I think that guerrilla medicine really is not very different from medical support to irregular forces, um, with the exception that guerrilla medicine is also really focused on providing care to the civilians affected in the area, whereas medical support to irregular forces is mainly focused on irregular forces, which, it tends to limit itself more to like the military population. I think it's important to understand that guerrilla medicine is something mostly practiced by civilians, I would say, because the military and their mechanisms of taking care of casualties is already well established. They have they have the whole training continuum, combat medics, combat lifesavers, designated medevac vehicles, etc. And they are put in place to take care of the army and the armed forces primarily. And during conflicts, what we saw in Ukraine, for example, one of the primary lessons learned, I think, is that the armed forces and their medical services were immediately at their limits and were basically exhausted by just taking care of their responsibilities. And when civilians were hit, the civilian emergency medical system was just not prepared to take care of these patients. So I think it's important to realize that the guerrilla medicine aspect will be mostly something done by civilians, and set up by civilians, run by civilians. And I think that's one of the key differences between a military medical support effort and a guerrilla medical support effort.
So are you saying it's similar, or there's a huge overlap from guerrilla medicine to like disaster medical relief?
Definitely, that's definitely a huge overlap. Yes, and of course, like in disaster medicine, we think more about like patients that are affected by non-intentional trauma, basically, or like non-directed injuries, and yeah, sadly, in guerrilla medicine, we are still looking at treating people, like based on the wounds that are inflicted through conflict. So the injury profile is a bit different, but essentially, in terms of like organization and in terms of running these systems, I think the overlap is definitely there between disaster relief and guerrilla medicine. Yes.
So it's interesting to me that you see this as a niche that goes in hand, or in a brotherhood with wilderness medicine, with MSIW, with disaster relief, but it's a clear and distinct cut of the pie.
It is. Yeah. Also the nature of it, like once you look into the operating environment of guerrilla medicine, you find yourself in an environment that requires clandestine approaches, that requires underground organization, that requires secrecy, low visibility. So it really is a very special environment that is very difficult to navigate. It's a very high risk environment. And therefore it's even more important that we train this early and that we understand that, the civilian medic will be put into a position where they have to perform at a very high level with minimal time to prepare. So yeah, without advanced education and training, it's very difficult to establish such a system. And in the few instances that have done that in Ukraine, it's been a huge success and a lot of people lived. And sadly, in the majority of places where it wasn't established early and where these capabilities haven't just spontaneously, become reality, the outcomes were pretty dire. So I think that really urges us to take this very seriously and to put guerrilla medicine on the radar of more people and make it a civilian discussion that needs to be held. So
I understand you're saying that guerrilla medicine is very much a civilian thought process, a reality. And if you look at a Venn diagram of medicine, you're going to have overlap, of course. And you mentioned semi-permissive environments. That is going to be one overlap in the Venn diagram with MSIW and conflict.
Absolutely. Yes, definitely. And I think it's also key to understand that the civilian who will be running this is still put in the same threat profile as the military medic running their own, military medicine side. So the civilian medic needs to learn from the tactical medic and needs to look at things like TCCC, needs to look at things like prolonged field care, needs to learn about implications of enemy targeting, and how that will affect the patient care and safety and stuff like that. So it really is very closely related to tactical medicine. So it kind of raises eyebrows often, when you start talking to civilian medics about drone threats and austere covert clinics and stuff like that. So it's not an easy discussion, but sadly, in this very rapidly evolving world, this is a reality that can, manifest itself suddenly, and then you're stuck with this new reality and you're unprepared. So yeah, it's a very difficult field to navigate, but it's something that we just need to get a move on and start developing procedures and talking points.
So the hope is that your passion and your push for guerrilla medicine can be taught and learned and implemented now when it's not needed as much, for the hope of eventuality to be in that semi-permissive environment to be able to utilize these same skills.
Exactly. Yeah. I think thankfully now the conflicts in Europe seem to have tamed the threat at the European border, more or less. And other European nations are not really affected by that. But if we look into the future and we think about how the threat profile can evolve, perhaps it's not the Europeans fighting that battle. Perhaps it's the Americans implementing guerrilla medicine, or some people in Asia or the South Americans. To me, a life saved is a life saved. Like, I'm super happy if other people implement these steps and save their fellow countrymen. So yeah, I think if we can develop these systems now, we can talk about it and discuss and educate. I think humanity as a whole will benefit, because we'll be better prepared for when disaster strikes, and whether that disaster is man-made or natural, that really is another discussion. But yeah, that's the goal.
It's a profound goal to have, and it's a benefit that would be palpable for many people in that. Well, they're not at the moment outside of Ukraine, but you're basically training for the future situation. I'm going to say conflict. Right. You're training for the future problem.
Right. And yeah, I think if we look at South America, for example, right now, or in Asia, in Western Asia, there is a lot of opportunities for this knowledge to be used, because basically any time where it doesn't even have to be a foreign entity that attacks. It can be a civil war, or like any local conflict that just cuts you off from regular medical care and forces you to become autonomous and to work without being detected. So the applications are pretty widely usable, I would say, sadly. So yeah,
it was definitely fascinating hearing that, and you're not alone by any means. There's a lot of people who are trying to address this issue. But Antonio, my final question for you is this: what advice do you have for the new doctor, the new nurse, the new paramedic who is just starting out in their career in austere medicine?
Ask questions. Have humility. Know that you're at the very beginning of a steep slope of learning, and that is totally okay. Eventually, there is a moment where you gain, or at least for the moment, you feel like you know enough, and that is great. But if that's not the case, don't be afraid to ask questions. We're all eternal students, even the people at the top, and be of good courage. Be happy that you chose this amazing profession, and become the best you can be.
It's been fantastic talking with you. It's
been a huge pleasure.
Making the world a better place in your lane of fire. It's interesting to see what you've done, and I look forward to seeing what you can do.
Well, that's extremely kind. Thank you, Aebhric. I really appreciate it. I want to thank you for inviting me here to talk to you. It's an honor, and I'm really looking forward to the future as well.
This
has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.